Hey there, it's Dr. Jim. I have a question for you. Have you ever heard of this concept called mindfulness? And have you ever applied it to your personal life or your work life? Well, I have practiced mindfulness for at least 2 decades, if not a little bit more. I find it very useful as a stress management technique. So, my topic for you today, since I'm in the healthcare world and the senior care world, I like to gear my research towards helping healthcare professionals. So, my topic today is mindfulness and well being in healthcare professionals. So, mindfulness and other stress management practices are essential, I believe, to the health and well being of today's overstretched healthcare workforce. And overstretched they are. They tend to be more vulnerable to high rates of burnout, physical injuries, emotional fatigue, and sometimes even moral distress. Do they believe they're doing the right thing? It's important for healthcare professionals to understand the power of mindfulness, why it matters, and the benefits from this very effective stress management technique. It's well documented in scientific literature that healthcare professionals face a number of problems, sometimes crises, including things like high workloads, long work hours, staffing shortages. They hate to hear those two words. Emotional exposure to suffering, illness, and death. Ethical dilemmas, and administrative burden. These problems and many others can contribute to negative consequences, including the following: burnout, anxiety or depression, compassion fatigue, increased medical errors, not good for patients or residents or clients, and ultimately reduced job satisfaction. Let me explain what mindfulness is. It involves the practice of paying very close attention to the present moment without judgment, without labels, and with openness and curiosity. That's not easy because you and I are always in situations where we're labeling everything around us, we're labeling people around us, we're labeling interactions. It's just it's a psychosocial thing that we do. Mindfulness, though, focuses on awareness of your thoughts, your emotions, and physical sensations. So, am I becoming tense? Am I becoming angry? Do I feel electricity pulsing through my body? So, during stressful times in the workplace, the healthcare professional, during a stressful moment, can pause for 30 seconds, take a deep breath, and say this. This is stress, but stress is involved in caring for others. It's natural and it's normal. I realize this, and I will be calm and present by the time I get to my next patient or resident in senior care. How does mindfulness benefit healthcare professionals? Lots of benefits documented in scientific literature. Research shows that the practice of mindfulness for anyone, but especially healthcare professionals and caregivers, since we're talking about that, yields a bounty of physical and emotional health benefits. For instance, mindfulness is effective in reducing professional burnout, which is a condition far worse than stress. I always create this visual analogy. Stress, you're climbing a mountain, it's very rugged, the terrain is terrible, it's challenging, but it's stressful, and then finally you get to the top. And now you can't find your way down. That is burnout. Mindfulness improves how healthcare professionals handle stressful information, situations, and it can be practiced on the fly, and that's why I like it. It's like it's right here in your pocket. Mindfulness. It's a tool. It's a technique. It's stress management. It's right there waiting for you. It's also been shown to enhance patient care and team dynamics, as well as unity in the workplace. This is an interesting concept. Mindfulness micro practices. Since healthcare professionals don't have a lot of excess time to practice stress management, mindfulness can be done in micro sessions. Let me explain. This means that the professional can engage in deep breathing for 30 seconds before continuing work. He or she can also take note of the bodily sensations and associate them directly with stressful moments in order to gain understanding of bodily response to stress. The person can place their hand on their heart and reflect with gratitude. No storm lasts forever. Everything passes. The stressful moment will pass as well. Here's some final thoughts on mindfulness. Today's nurses, social workers, case managers, therapists, administrators, nursing assistants, everyone, they have a lot on their hands between corporate compliance, quality care, turnover, and so many more issues that do cause stress, burnout, ultimately turnover. They leave. One stress management technique that may benefit them is mindfulness. Understanding it and successfully using it daily can provide peace and balance in the hectic healthcare professional's work life. I'm Dr. Jim. Keep coming back to my blog, drjimcollins.com. Visit my other two companies, Collins Learning, for online compliance training for your entire staff, and CEU Academy, if you need some CEUs for your license. I hope you enjoyed the video. And if you're looking for online continuing education, CEUs for your own license, check out CEU Academy, where we create fresh content every single year, very timely, important topics. And tell your colleagues who are licensed healthcare professionals as well. Follow the link below and check out ceu.academy.